and welcome to all of our Gold viewers from around the world. I'm Kristen Schwarz, a licensed midwife and one of the MCs here at Gold. And here at Gold, we're in the middle of producing a brand new lecture pack titled Forming Comprehensive Conversations for Common Breastfeeding Challenges. And I am here and I'm very, very honored to be here with one of our speakers, Dr. Divya Parikh. Welcome, Divya. It's good to have you here.
Thank you.
It's so wonderful to have you back here at Gold.
Thank you. It's great to be back too.
Wonderful. Yeah, you are going to be presenting on a very, very important topic, too much milk evaluation and management of hyperlactation. We're going to jump into that in just a moment. I just wanted you to tell our viewers, where in the world are you coming to?
Yeah, I am located in Columbus, Ohio. And I work at a private pediatrician practice, so outpatient primary care. And so as part of our primary care, I offer lactation services to all our patients.
Beautiful. So you are a pediatrician, is that correct?
Yes.
You have, and so I know you've been with us at Gold before, but for anybody who doesn't know you yet, how did you happen to also get into the field of lactation there, that became one of your specialties basically there as well?
Yeah, it was unexpected interest. So I remember being a medical student, we had these electives that we could sign up for in our fourth year. And I knew I was going into pediatrics and I said, you know what, let's just sign up for some things that might be helpful to know about. We had a breastfeeding elective. And I said, let's just try it. And I went to medical school in Pittsburgh. So there was a physician, Deborah Bogan, at that time, who was in charge of that. And she was very passionate about it, you know. And she built this wonderful elective. It was a whole 4 weeks where I got to see so many different things and learn so many things. I had no idea, you know, going into it. And from there on out, I think she just really impressed with me the importance of it and the value it has in pediatric care and beyond. But obviously I'm a pediatrician, so that's my focus. And I just thought it was a really neat thing that I was like, why don't we learn more about this? It just makes sense. So then when I got to medical school, or residency after medical school, I noticed that we didn't have an elective there. And it was such a big influencer in my education and my desire to do pediatrics. And so I was like, well, we need this here too. And this is a missing piece. And from that, I think just my knowledge and my interest became focused. And I learned also that I just really love primary care. And I was like, hey, these things just go hand in hand. So let's just make it official. And so that's kind of what prompted me to kind of get my IBCLC too, because during residency training, you're doing all these hours anyway. So it ended up not being too much of a leg to also get the IBCLC. So
beautiful. So, Thank you so much for sharing that. And you brought up a very important point. You took that elective and then went into the program. So, you know, wouldn't you say it, you know, considering that, human milk is the first food for the baby, for the newborn, you know, ideally, why isn't this taught more in medical school, especially becoming a pediatrician?
Right? Yeah, I think there's been, I have to be fair and say, I think people are trying a lot more than they were when I was in training. And of course, there was even less before I was in training. So I have gradually noticed it become more of a norm in the curriculum, but of course, there's always room for more growth. I just think it's awareness, you know, I think there was a lot of not breastfeeding that happened for a generation or two, and we just lost some awareness. And as we're building it, we're realizing how important it is, and it's making its way back in to our curriculum. But I'm an optimist, so I have a very optimistic view.
You brought up a very good point, because as you said, that, you know, it's more prevalent nowadays in the curriculum because newer doctors or younger, you know, the next generation of doctors is probably pushing more forward, seeing the importance of it. So that gives us hope, right? Yeah. So let's talk about the topic, too much milk, evaluation and management of hyperlactation. A very important topic. IBCLC see that, in their practice, families coming in with, a complaint of too much milk, but also a little bit, we can see it probably that somebody might look at this going like, what's the big deal here? You know, too much milk is better than not enough milk. Why are we, what is this? So tell us a little bit.
I think we're seeing it more and more because I think, we have a lot of ways to augment our milk supply. And
Mhm.
so, particularly with medications and herbs and breast pumps in particular, and
Mhm.
a lot of individual lean on breast pumps if latch is not going well. And breast pumps don't have satiety cues, right? The way a
Right.
baby does. So there's not a
Yeah.
lot of negative feedback. And so I just feel like with all this technology that we now have to use, we're able to maximize, and we learned that more is not always the best. And so when people come to me like, why is this a problem? There
Mhm.
are risks for infection, there are risks
Mhm.
for pain. And if it's a painful process, people just simply aren't going to do it. And
Right.
so it needs to be treated. It needs to be managed in a way that's comfortable for the family.
Mhm.
Yeah.
Do you think sometimes social media is also to blame for that? Because augmenting milk supply, we always see these feeding the freezer and
I
kind of
know. Yeah, I do
these
sometimes tell my
pictures.
patients, yes, yes. And I have some patients that come in like, I only pump like 3 ounces excess of what my baby needs. And I'm like, that's great. That's perfect,
Yeah.
And I use this, feed your baby, not the freezer. That's kind of
Right.
my quick catchphrase that I kind of tell to my patients whenever they run into this situation. I do agree. I think sometimes you see these freezers and you see these pictures and you get this sensation that you're like, oh, is that what I need to be doing? You really
Yeah. Yeah.
don't,
Yeah. Hmm.
Yeah. And everyone's situation is different, maybe for that parent, it wasn't a painful process, and maybe for you it would be. So is it worth it?
Yeah,
Yeah.
absolutely.
Hmm.
Could there also be underlying medical condition for making too much milk?
It's possible. Yeah, that's a complex question to answer because I don't think there's any studies to date that show like there's a hormonal imbalance that really
Mhm.
tips it that needs to be addressed. But I don't know. I think some more controlled studies need to be done for that.
Interesting.
Um,
Yeah, yeah.
yeah.
That would be of interest to me too, and see if
Hmm.
there was anything that could be, especially hormonal imbalance,
Hmm.
that could lead to that as well.
Yeah.
And yeah, you mentioned treatment. You will talk about that in your presentation. I had a little sneak peek.
Yes.
I have to say, I am so impressed. You give us so many tools there that we can use in our practice with our families that are, also holistic medication as well, but also
Yeah.
more holistic treatments and herbs and such. So
Hmm.
we get a wide variety of tools for our toolbox here to work with any client where they are, right?
Yeah. Yes.
Absolutely.
I
That's
know. I'm glad to be able to share all that with you. So,
wonderful. I'm so
yeah.
looking forward to this. Now, Divya, before I let you go, what kind of little wisdom of nugget you have when it comes to that topic for our viewers here briefly?
Mm, let's see. With hyperlactation and all breastfeeding, um, your strategies for intervention are going to be very individual
Mhm.
because the parents and the infants are all like individual combinations of everything, all the factors that go into
Right.
why am I making too much milk, I can give you an example that's not, well, this was related to hyperlactation. I had a mom with hyperlactation. Her infant had a pretty clinically significant tongue tie. And I was like, there's no point clipping it because you're not having breast pain and you make a lot of milk, you know, whereas in a different context, you have a low milk supply and a clinically significant tongue tie, maybe I would recommend that you clip it. So just knowing that your recommendations for what you see are all contextual.
Yeah.
That's what I would really share. Like, know the context you're looking at along with the parents' goals, because your strategies are going to be completely different for different dyads.
Oh, that's a
Yeah.
good one. That's a really a good nugget.
Yeah.
Know the diet, and it's not one fits all. And just
Yeah.
because you have your lists of herbs and medications, you can just tick off and go through. No, really look at the family, the diet, and
Mhm.
what's going on in particular there. That's wonderful. Well, Dr. Divya Parikh, it was wonderful talking to you here, and I'm very excited about your upcoming presentation here for the lecture pack.
Thank you very much.
And now some information for our viewers here. The presentation, Too Much Milk, Evaluation and Management of Hyperlactation, is part of the lecture pack, Forming Comprehensive Conversation for Common Breastfeeding Challenges. And that will be available April 3rd. This is actually right now an add-on package for our GOLD Lactation Online Conference 2023. We get started with that conference also on April 3rd with a free open access keynote presentation. You can sign up for that, find more information. And I tell you now where you can find it. I know you want to go there and sign up for all of that. Go to goldlactation.com. There you'll find all the information on all the presentations, how to sign up, and also take part in the free open access keynote on April 3rd. Thank you again, Divya, for coming here today and spending time with me today. And thank you to all of our viewers for participating here with us today. And I hope to see you all at the conference and at the lecture pack. Bye-bye, everyone.